Right, so here's a couple of images that show the difference between the tension-free vaginal tape, or TVT, and the transobturator tape, or the TOT. So on the left we have the TVT, and the blue wiggly thing, that's the permanent synthetic mesh that gets implanted. And you can see it goes behind the pubic bone and under the urethra. The tape's actually positioned at the middle of the urethra, not at the very beginning of the urethra, as is shown in these pictures, but that doesn't matter. The TOT goes through that funny little hole in each pelvic bone called the obturator foramen, and then underneath the urethra. So the TVT was the first mid-urethral sling described and used commercially, I think some docs got uncomfortable passing that tape blindly behind the pubic bone because there's a lot of great big veins back there, and you're more likely to push the introducer through the bladder wall, which isn't actually a big deal, but it's a pain in the neck. And so someone described the TOT, and it worked pretty good as well. But the question is, which is better, TVT or TOT? And believe it or not, this has been studied and published in the New England Journal of Medicine a while ago, back in 2010. And so they found that comparing TVT patients, the dark blue, to the TOT patients in the gray, the TVT may have worked a little bit better. Stress test is when you have a patient after the procedure stand up with a full bladder and cough and see if they leak or not. If they do, it's a positive stress test. So, about 18% of the TOT patients had a positive stress test, maybe 15% of the TVT patients had a positive stress test right after surgery. So that's probably that's not as likely to make the patient feel satisfied as someone who doesn't leak at all. Although if you make someone significantly better than they were, like say 70% better, they're probably going to say they're satisfied and happy with the results. And so success in most of these studies isn't defined as being completely continent, but more than 70% continent is a typical threshold for defining success. And then there's these other things called the PAD test, which really isn't used anymore. That's kind of an older study. And whether they got another surgery for incontinence, comparable results for TVT and TOT. And when they came and talked to the doctor, did they describe leaking urine with physical activity? That is to say, stress-type symptoms of incontinence. So when they cough, sneeze, laugh, are they leaking? And the patient says yes. You can see maybe a little bit more often for TOT than TVT, maybe in the range of 20 to 25%. So now a fifth to a quarter of patients are telling the docs that they're still leaking. But when they fill out a diary, the results are a little bit worse, right? Maybe 30 to 35% of patients record leaks on a 3-day bladder diary. But again, most of these patients will say they're happy and satisfied because they're just so much better than they were. And that's why generally people quote success rates with mid-urethral sling, whether it's TOT, TVT, in the 80% range, maybe even a little more. And they seem to be pretty durable, meaning the good result lasts for a while. Now, sometimes remote from surgery, years later, you develop overactive bladder because people get overactive bladders sometimes. It doesn't mean your sling isn't working. That's a different type of bladder problem, totally separate from the stress incontinence that was treated with the sling successfully. It doesn't mean the sling failed. It just means that, unfortunately, overactive bladder is common. So anyway, that's the story about surgery and its success. One last thing I will mention when comparing TVT to TOT is the TVT patients were more likely to have difficulty emptying their bladder, and about 3% of them had to go back to the operating room to have the sling cut or adjusted, and 0% of the TOT patients had that problem. So that's something to bear in mind as well. Fact of the matter is, your doctor probably prefers one or the other. They probably are doing and prefer the TOT if you're seeing a gynecologist, really, or a urologist. It's just more commonly performed now. But this is something to think about, talk about. And if you have questions, ask about. Put them in the comments and I will answer them. Let me know what you're interested in hearing about. Again, like, subscribe, wake the neighbors, tell your friends. Be a part of our community. We'll talk to you soon.